Welcome to Robert Wood Johnson University Hospital's Health Talk. I'm Dr. Douglas Oshinsky of Robert Wood Johnson Physician Enterprises, Warren Internal Medicine. For people who live or spend time alone, a medical alert service can offer peace of mind, and in that, an emergency can help be summoned with just a click of a button. The Robert Wood Johnson University Hospital's Lifeline program provides medical alert services to more than 500 subscribers in central New Jersey. In 2015, the service assisted with 583 incidents. Today, we will learn more about Lifeline from our special guest, Kathi Bennett, manager of the Lifeline program at Robert Wood Johnson University Hospital, and Eileen Amoroso, the education coordinator for the Lifeline program at Robert Wood Johnson University Hospital. Both of you, welcome to the show.
Thank you. Thank you for having us.
Well, I actually want to thank you because both of you represent Lifeline, which is part of Robert Wood Johnson University Hospital. As a physician, I think it's so important that as my patients are leaving the office, I have a display with your Lifeline stuff at the end of my office. And I think it's such an important service, and I want both of you just to tell me a little bit about who you are and what got you involved in Lifeline, and then we'll talk all about Lifeline itself.
Okay. I'm Kathi Bennett. I'm the manager of Lifeline and have been for almost 20 years now. When I started, we had 127 clients, and now we're up to almost 600. The program has grown tremendously. I was drawn to it because my mom needed a Lifeline. And she had it for several years before she passed away. And then I asked my dad to continue on with it, and he's very independent, and he said he didn't need it. And I said, well, if you would please get it just for me, just for my peace of mind. And he agreed, and that was 15 years ago. He has relied on it tremendously, has only had to use it once, but feels that safety and that peace of mind for having it.
And Eileen?
I'm the education coordinator, and my position is to go out and educate the community. I go to senior centers, companies. I also go to the doctor's offices, and I go around and I do marketing, and I put out displays with the Lifeline, and I encourage, if I can talk to the doctor, that's great. If I can't, I talk to the office manager, and I encourage them to please put this out because we're trying to make the community safe. Another part of my job is I actually go to, inside the hospital, I actually go to the bedsides of patients, and I meet with them and or their families and encourage them to have a safe discharge from the hospital.
Lifeline. Tell us, what is Lifeline? Tell us who's a good candidate for us, and educate all of us on Lifeline.
Lifeline is a medical alert service that enables you to get help in case of an emergency. And a good candidate for Lifeline is truly anyone who either lives alone or spends time alone, because if there's an emergency, and emergencies can happen to anyone at any time, regardless of age, if you're alone and you can't get to the telephone, there can be some dire consequences. With Lifeline, you press a button and you have contact with a monitor within 30 seconds.
Now, we have a big demonstration here. Each one of these components. Do you want to tell us each about how each thing is, how these things work?
Sure. Eileen, did you want to describe the buttons?
Sure. This is our standard button.
Let's start from the get-go. A person, they come to my office, they have the brochure from Lifeline. They fill it out. What happens from then?
Well, they would actually call us at the office, which is 908-704-0096. They would talk to one of us who would answer the phone in the Lifeline program, and we would talk with them and discuss options with them, whether or not they wanted something that was for the home or on the go, and we would set up an appointment with them, and we would determine if they were going to go with our local service, which is Robert Wood coming out and doing the install, or it would be direct to customer, we would ship to them. And then if it was a local service, we would actually go out to their homes. It's about a 45-minute to an hour,
education.
Yeah, education, but also setup. And whether it's just a client and or the family or a neighbor, whoever it may be, we go over the whole system and we teach them how to use it. And then they're on the service.
Okay, so show us what you would come out with, what you would show.
Okay, so this is our standard button. As you can see, it has a like a cover over it, and what it is protecting it from accidental pushes. It also has the button in the middle, and it has 4 little bumps, so that, God forbid, it was in the middle of the night and you were wearing it as a pendant, and it was flipped over, and it was dark, and you had fallen, and you had hit your head, and you needed assistance. There's 4 little bumps that are like Braille, and you would be able to push the button, and you would know that those 4 little bumps that you were pushing the button, you were going to get the help you needed. You can wear this particular button. You can wear it on a neck cord, or you can wear it as a watch. Some people don't like things around their neck, so we offer this, and it's as flexible. This is 100% waterproof. All of our buttons are waterproof. So what would happen is if the client pushes their button, the button sends a signal to the machine then dials out to Lifeline up in Massachusetts, and a live monitor from Lifeline who's trained comes on the phone and will ask, for example, Mary, do you need help? This is RWJ Lifeline. Do you need help? If Mary is able to answer, that particular monitor will say, what can we do? What happened to you? Do you need help? Mary will say, I've fallen, I'm bleeding, and it depends on how it's set up at the time of the install. Mary might have indicated she wanted a neighbor or her son contacted or whatever it may be, or just the police. It all depends how it was set up. If Mary is unable to be heard, what will happen is the monitor will try and call Mary on her telephone. If Mary doesn't answer, they know that she's within the range, and they will, again, the protocol will kick back in place, whether it be a son, a daughter, a neighbor, or the police.
Okay, so now do we have to have this piece and this piece at home?
This piece is what we call our landline unit. So for people who have landline phones, we hook this up to the electrical outlet and also to the phone jack. We also have, for people who have abandoned their landline phones, and many have, we now have a cellular wireless unit. This unit just gets plugged into an electrical outlet. No telephone is needed. There is AT&T cellular service inside the unit itself, so that the client doesn't have to have a particular cell service, doesn't have to have a program that includes this Lifeline. It's all inclusive right within this unit itself. So we have been able to offer products to all kinds of people with landline phones and people that do not have landline phones. We have units for people who want to be on the go as opposed to just within their homes. And Eileen can go a little bit more into detail about our Go Safe feature.
This is our Go Safe, and this is for anybody that is on the go, active or people that are on the go. This will work anywhere in the United States. It would come with a unit that would look like this, but if you were on the go, you would leave this at home and you would be on the go with this. So say you went on vacation to Florida, and God forbid you fell, hit your head, and were knocked unconscious. Lifeline has built technologies in here to locate you regardless of where you are. For example, some of them are Wi-Fi, GPS. There's a beacon. There's what they call breadcrumb. It's cell tower to cell tower technology. There's a speaker built in here, and there's fall detection as well, or the push of the button. If the person was unable to speak, Lifeline would talk to them through the button. If, again, they were unable and they were unconscious and able to speak, the locating technology that is in here, Lifeline is able to pinpoint exactly where they are. We do have Wi-Fi, which is wonderful because you know that GPS sometimes can take you to dead ends, and it doesn't really work in the buildings, and we all know that. It's a very good system, but it doesn't work in the buildings. So with the Wi-Fi, and Philip's putting in the Wi-Fi, the person can be located inside of a building.
Very nice. Nice technology. So we start off, the person calls you, calls the number up, speaks to you. Do they have to set up an account? How does it work?
The first thing we would do is get all of their information, their demographics, their medical history, and so forth. We would go and do the installation if they are going with our landline, with our Home Safe service, where we go out and do the local personal touch, we call it, where we go out and do the installations and the maintenance. At that point, once we get all of our paperwork signed off by them, then we do billing at the end of each month. So it's not a long-term commitment. It goes month by month. So a client doesn't have to feel as though they're stuck for any length of time. We understand that situations change very quickly. And so just 30 days notice is all that we need to disconnect the equipment for them. So it's a quite easy process just by giving us a call saying, I am interested. Can you explain to me all of the different tiers of service that you have? We go over everything with them and then again go over everything more thoroughly at the time of an installation.
And again, you said that you give this to people who are going to be alone, but would you even say elderly couple would you give it to?
Absolutely, because the couples aren't typically together 24 hours a day. There are times when maybe the husband or wife is out at the store or out in the yard, and so many times couples do get this service. But it's not only for the elderly, and that was the stigma years ago. Everyone thought, oh, a Lifeline is for the elderly and the frail, and that's not the case. We do have people who are older on our service. We do have people who have medical conditions. But we also have younger seniors getting on board with us now simply because they're widows or widowers, and for the first time, they're home alone. And so because Lifeline is not just for a medical emergency, but it can also be for an intruder. If you smell smoke in the house, if a guest of yours is having a medical emergency, it's for any situation that makes you feel uncomfortable. And so our widows and widowers are really feeling that peace of mind by having a service like this. We also have younger clients in their 20s and their 30s. We have some who have seizures, some who have MS. And so this service truly isn't just for the elderly and frail. It's for anyone who spends time alone.
So it's no longer like that commercial on TV that from 20 years ago, help, I fell and can't get up anymore.
No, it's not. It's not. It's grown quite a bit from then.
Okay, so again, the person calls you up, they get the contract signed. What happens monetarily wise if they can't afford it? Do we have any help for them?
It typically is a self-pay. Medicare does not cover this service, unfortunately. But what we have found in the past is sometimes churches will sponsor. We've had family members, oftentimes children, will pay for the service, especially nowadays when children are all over the country. And so for them to pay $35 a month or so for the safety of their parent, that's a really nice option for them. There's also a couple of programs through the state that if you qualify, both medically and financially, you can get some cost covered through them. Okay,
and then you have this unit here if we need it for a landline, this one here for the wireless. Auto detect if the person falls.
Mm-hmm. We have what we call the auto alert, and this can only be worn on the neck. It cannot be worn on the wrist as the regular PHB personal help button. And what it is again, it's the button with the concave, so there's not a lot of accidental pushes, and there's smart sensors built into here. So if a person was to fall and they had a velocity fall or an impact fall, we call it, the smart sensors would detect it. If the person did not correct themselves after 30 seconds, again, the button will send a signal to the machine. The machine's going to call up to Lifeline, and it's going to go from there. So that's the other thing is if a person is sitting on, say they're on their bed or they're on their couch and they slide, when they slide and if they're vertical and it's not an impact fall, they're going to have to push their button because this does pick up 95% of the falls, but again, it's an impact fall. So a slide, they're still considered vertical. It's not going to sense that they're actually down. Even if they have a little fall and they're on the ground, if it wasn't an impact fall, it won't pick it up. So, but we encourage everyone to push their button and wear their buttons 24 hours a day.
So even in the shower, we wear the button?
Absolutely, 100% waterproof.
And in fact, we really do need it in the shower because at all places, that's one of the places someone will fall.
And it could be that midnight trip to the bathroom that you fall. And that's why we encourage you also to wear their button.
Okay, so you called this, what did you call this?
A PHB personal help button. This is our standard service. And this is our auto alert. And then we have our Go Safe.
Okay. I was interrupted you. I'm sorry.
No, that's fine. The one thing I did want to mention is that with our personal help buttons, although they work just in and around the home, we still recommend that people wear their buttons even when they go out and about, because when they get back on their property, should they have a problem getting out of their car or getting up the steps to their home, they want that button on them so they can press it.
So what happens if they leave the house and they're wearing this button?
Well, if they're still on the property, it will work in the home and the surrounding yard. A lot of our clients are now 55 and older, to where they want to be able to go to their mailboxes or their garbage can, and it's down a little ways. So what we do is we ask them, where do you go the most? Do you go to the garbage? And it will work in the surrounding yards. If you're in a home or a condo, it will, or a townhouse, whatever it may be, it works in the surrounding area. And we actually do a range test when we come out, and we tell you where the range is that it will stop. But it's a good 300 to 500 feet in some cases.
And this one here, you said this is the one that has the GPS in it, or is that one?
This is the one with the GPS.
Okay, so this one here, the difference between this one here and this one here?
Okay, this has the auto alert, the fall detection sensors built into it. So this is a button and the auto alert, the fall detection sensors, and this is just a button.
Okay, and the other one is the one, the go is if you
Go safe.
Okay, and that one is good throughout, you said, all of the United States?
Yes, and you leave the unit at home, and you just bring this and your charger wherever you go. Okay,
so since this is electronic equipment, how does the person know that it's working? Is there a fail-safe in case something happens? If something breaks, how do we repair it?
Our equipment tests itself every 7 days, and it makes sure that the unit is hooked up properly and it's getting electricity and it's getting the phone line if we have this unit. The buttons also marry up with the machines to make sure that the button is in the home and that it's working properly. And then we get faxes. Because the machines silently test, the fax will come to us to let us know if a button is getting low. Batteries usually last in buttons for up to 5 years, but if it should get low, we get a fax that lets us know that we need to replace it. Also, there's backup batteries in these units as well. Those batteries last about 3 to 5 years also, so that if the power goes out in the home, then those batteries will kick in. So if the person has our local program, which is the local personal touch where we go out and do all of the maintenance, then we would go there and replace the button and replace the battery for them. If they decide to go with our what we call direct-to-customer service, where we ship everything out to them, then we would do that. We would ship out a new button or ship out a battery. So the equipment is so good that very seldom do we need to do maintenance on it. It truly is that good. Philips has done a phenomenal job. They put lots of research and development dollars into their equipment and service, and they're constantly improving upon it.
So even in no power, it still works because of the backup battery?
Right.
So in the middle of the storm, if the lights go out and they fall, they still can push the button?
Yes, it's a 30-hour battery backup.
And then once the power comes back on, then it just recharges itself. And one storm years ago, it was a terrible storm, and one woman, her power kept going out. And so every 24 hours, I would go up to her house and give her a new battery because she was all alone. She didn't have family, and she absolutely did need the Lifeline. Many times, though, if power goes out and we have a terrible storm, most times family members will take the client to their home and not want them in that environment anyway. But we do have that ability to go to the client's home every 24 hours if need be to give them a new battery.
Well, first I have to congratulate you for being so wonderful with your patients that you actually went out to the house to do that, because there aren't many that would do something like that, and you probably saved that woman from being fearful of being in her own home by herself. So you were a godsend to that woman.
Thank you. It meant a lot to her. It truly did. People become very attached to Lifeline. Many times when we first install a unit, the client may not be that excited about getting it. But truly, a few days later, they'll call us and say, I'm so glad I got the Lifeline, but don't tell my daughter that because I told her I didn't want this. But after a little bit, they do become very comfortable with it and they rely on it a lot. And so if the power does go out or if the battery is getting low, they do want our attention right away, and they deserve it. This is a life-saving piece of equipment that needs to be working all the time. And
again, they contact your company, they fill out the forms, they have a monthly charge, so they're not on a cable contract where they have to sign up for 2 or 3 years.
No, they don't. And there are other companies out there that do have that in small print many times in their contracts, that it's a year or 2 or 3 even automatic renewable contracts.
Let's talk, most of them are like that.
But Philips realizes that the situations change very quickly and we have to adapt to that.
Tell us more, some other information about Lifeline, since most people don't know very much about it.
What we can tell you some situations.
Sure,
Yeah.
Let's hear about situations.
We had a man recently, within the last month or so, who was in a building at an event, and he went into the men's room, washing his hands, and he suddenly became a little disoriented, and he had a fall. He was wearing the Go Safe button that works wherever you go. And he had the fall. It was an impact fall, so the button detected the fall and sent a signal into Lifeline. Lifeline was able to determine which building he was in and was able to speak to him over the button and say, are you okay? And waited until he got himself back up again and he was okay. So that's an example of how being out and about, things can happen. You can be by yourself, and the Go Safe is really a godsend for people out on their own. However, most of our clients tend to get the home safe units because that's when they're typically alone. And it is, of course, less costly, but we do have an array of products and services because there are so many different types of clients out there and everybody's need is different. And so we pride ourselves on the fact that we can offer lots of different options for anyone who would be interested in Lifeline.
Again, important because all of the different types, different varieties, and of course the different costs that go with it. Most of us thinking about the regular button because we're thinking of it being our parents in the house, then really not going outside or anything like that. And really what we want to do is make sure that if they need help, all they have to do is push that button and there's someone available.
Exactly. We've had clients who go out in the garden and love it and don't want to give that up, and yet their family members might be very fearful for them being outside. Well, now they can, even with our Home Safe, because it does work around the yard and down the street sometimes. So it enables people to remain independent. It's not a hindrance. It really is a method of staying independent and doing the things that you love to do, and just knowing that if you get into a sticky situation, you have a way of getting help.
And again, a protocol with the button being pushed. Protocols being, they call, who would they call? You know, if you push the button and that means that the person's looking for help.
Right. The monitor would answer and ask if the person needs help, and that person, the client, is able to speak out loud from several different rooms from where the unit is.
Oh, so this doesn't have to be in the same room
as... It does not.
Okay.
It goes, we try to put it in a central location or where the person spends most of their time. But it does have a very, very expanded range, voice range. So the monitor would say, do you need help? And the client could say, could you just call my daughter? I'm just not feeling very well right now. And the client would then have the daughter called or sent over or what have you. It's at the time of the installation that the client really goes into a little bit more detail with us about what they would want to be done if they're not able to speak on their own behalf. And that could be the neighbor being called or a family member or sometimes the police. So the client is in the driver's seat. As long as the client can speak, the client can say, I cut my hand slicing a tomato, I need an ambulance. And all of that is discussed in detail at the time of the installation.
And I also get sometimes faxes from Lifeline about the patient that they had pushed the button.
Yes, that's called our third-party notify. and we would send faxes to doctors, to home health agencies, to whoever the client would like for us to, so that if there is an event that takes place, you're notified of it as well, and then you can intercede according to what needs to be done. Especially with home health agencies, they will then know not to send one of their aides to the home the next day because the person has been transported.
So, since this is such an important thing, where should we be putting these brochures, et cetera? Who should we be talking to so more people learn about Lifeline?
Well, we put them all over the hospital, and we put them in the doctor's offices. And again, I do send them out, and I go to the senior centers. I go to health fairs. We just try and encourage a very safe community. But we try and just put them everywhere we possibly can think of. Rehabs, physical therapists. We're trying to catch the people when they go home. If we don't catch them in the hospital, we try and catch them when they're coming out of rehab. And again, it just takes one incident to go bad for you, and it could hold you up for months. We have a particular client, for example, that she came on after the service, onto the service after the incident had happened. She had laid in the bathtub for 2 days. So that's 2 days without medicine, 2 days without food, water, the bathroom, and everything. And it took that. She was in the hospital, then she had to go to rehab, and in order to come home, her family insisted on Lifeline. But it took that type of incident. You can have a lot of little minor incidences. It's just going to take one big incident.
So every doctor really should put these things in their offices.
Yes.
All providers should really have this.
Yes.
At the time of discharge from the hospital, we should always offer people the Lifeline.
Yes.
People who are going to physical therapy places should probably be offered it also. Anyone who's leaving a rehab facility.
Correct.
Nursing homes,
Correct.
etc.
And that's what I've been going around, and I have over 150 people that I've actually been going around over the last year and putting these and encouraging them and seeing social workers and case managers, whatever it may be, just to get the word out on that we're right here in your backyard.
And again, the important thing being that it's such a local thing. We have people like you who actually go out to the house and help fix things like that rather than a large company, and it's a month to month so that the person doesn't have to sign a long-term contract. So you bring the best technology available to the community setting and allow, families to have mom and dad at home and not be as worried.
Right. And studies show that Lifeline reduces readmissions and also allows for people to live longer in their homes independently. One of the other cases that we had was a woman who had just went on blood thinners and suddenly had a terrible nosebleed. She pushed her button and the ambulance came and took care of her. So there's so many different scenarios that may need help. And if you can't get to the phone, you could be in a lot of trouble.
Thank you both for being on the show.
Thank you. Thank you for having us.
This concludes today's episode of Robert Wood Johnson University's Health Talk. Please remember that the opinions expressed here by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral number at 1-888-MD-RWJUH. For more information about Robert Wood Johnson University Hospital's Lifeline services, please visit our website at www.rwjuh.edu or call us at 908-704-0096. Thanks for watching, and thank you both.
Thank
you
you
very
again.
much.